Himself. Can I have your videos on? And then on the chat group, if you can write your names, that those present at the moment, please.
I'm just writing it down. My video is still having issues.
No worries. No worries. No worries. So, no worries. If your video is still having issue, that's fine. So, we're looking at LO3. So let me just message all the other ones that you're about to start soon.
I'm here also, Dan. Hello.
Hello.
Yeah, I'm here. I've been on section also.
That's fine. Is Olusola right?
Yes. I'll be.
You have only 3 people. Let me message the other ones quickly.
All right, no problem.
If I pass my driving test, I could stay very.
Hello, guys.
Hello.
I've added
Hello.
John as well. Let me see. I've mentioned all the rest. You still have only 3 people.
You know up and down. You know the class supposed to hold by 10 to 11. Some people
That's
also
true.
will have a schedule. Like me now, I'm
Okay.
about rounding up because
Okay.
I plan. Yes, that's the major issue.
Okay.
Some will be
That's
at
fine.
work now.
That's fine.
Maybe
That's fine.
they will listen to the recorded version later.
No
So
worries at all.
yeah.
Let me send. I think I send a link. That's fine. That's fine. Somebody just asked for the link. 1 minute. All right. So let's crack on. LO3. So in LO3, we expect it has 3 functions: 3.1, 3.2, and 3.3. And we expect that learners to be able to achieve a pass mark. Learners should be able to identify and describe the principles underpinning health and social care, for which example is set up duty of care and ethical code. They should consider how this impacts on the provision of care, quality and safety of care of it. Learners need to explain initiatives to promote fundamental principles such as UK Dignity Agenda and the 6 C's, etc. And then if you want to achieve a merit, then you need to go beyond just the pass mark and then should be able to explain how those underpinning principles and values ensure quality, access, and coordination. And like I've always mentioned, for the merits, you would also need to go beyond what you have stated and then recognize that through these principles and values may not be mandatory. There are implications for which if you don't follow them, of course. You mentioned that if you don't follow these things, it can lead to prisons and all that. So those are the things we expect that in your submissions you cover this area. All right. Now, let me do this quickly and then we are good to go. Let's call it 1 minute. Just 1 minute. Yes, where I am now, let me go. Let me more. If you get more, yesterday I was there. I have a water tank of stone. So I don't know why they got more. Because yesterday I was there. Everybody was there. People didn't saw the thing of water. Water was going into it. Okay. I don't know if and all that, but their water was flowing. As for more people, every tenant business should know. You're not the one to tell tenants to get more. They should know that. I'll come there. I'm doing some lectures. I'm teaching now. I'll come there. I'll come there secondly. Can you guys see the screen, guys?
Yeah.
Okay, so I've mentioned that
Yes.
3.1, we seek to describe the underpinning principles of health and social care. 3.2, outline how these principles impact on the provision of care. And then 3.3, we have to explain an initiative to promote the fundamental principles among those working in health and social care. And 3.1, you have to assess how underlying principles support the basic human rights. And then the last one, learners should be able to assess the implications of failing to adhere to fundamental principles of care. So these things that we expect that learners should be able to understand that. Jessica, are you there with me? Can you hear me?
Yes.
Yes, can you? Okay, that's fine. Now, we have to also look into the values and principles that underpin service provision in a number of ways. When you are caring for people, it is important to show respect, dignity, confidentiality, impartiality, inclusion, individual rights, and responsibilities. You need to ensure that your own values and principles do not interfere with the delivery of care. Now, when we say the principles and values, we're looking at respect and dignity, which we all agree, commitment to quality of care. Everyone counts. Everyone counts. We're talking about equality and diversity, compassion, working together for people, improving life. Now, Jesse, Olusola, and Suleiman. Am I right? Is it Suleiman?
Yeah, Sulaiman.
Yeah,
Your name is
Sulaiman.
Suleiman, have you written your name on the chat room? I need your full name on the chat, please.
On the chat.
Yes.
Look, man.
Can you see the chat?
Yeah, I'm trying to type on it. Is
Yeah.
that what you want?
Yeah, put your full name. Put your full name.
Yeah, I've done that. Can you see?
So, have you put your name there, please? Suleiman. Okay, that's fine. That's fine. Suleiman,
Yes,
is that your
please.
first time
I've
of joining?
done.
Is that
Yeah.
your first time of joining us, isn't it?
Yeah, this is my first time. The other time,
Yeah.
I don't really I was at work, so
That's fine.
I was
That's
expecting
fine. That's fine.
the recorded version. All right.
Okay, that's fine. Let's move on. Okay, so Olusola, Jesse, what is your understanding between what's the difference between equality and then diversity, please?
Equality is where people aren't treated unfairly because of the 9 characteristics, the 9 protected characteristics.
Yep.
And diversity is people with lots of different characteristics.
Oh, that's you've not given the explanation the way I want it, preferably. Lushola, what's your take on diversity? Lushola, are you there? Silemon, what's your take on diversity, please?
Yeah, diversity. First of all, equality is being able to treat that right equally, and then diversity is the direct opposite of it.
So, Lushola, are you there? Okay. So, Jesse,
Yeah.
and so your explanations for equality, I will take it, but for diversity, I'm not accepting both Jesse
Okay.
and Suleiman. I want to hear the word diversity is accepting everyone's the way they are. Okay,
Okay.
do you understand me, Suleiman?
Yeah.
Because people have individual staffs, whether they are orientation, whether gay, whether lesbian. You know what I mean, Jesse?
Yeah.
So while equality is treating people fairly, diversity is accepting everyone the way they are, their diverse behavior. You know what I mean? That's the word diversity. Orientation, religion, you know what I mean?
Oh, okay.
You understand?
Yeah.
Yeah.
In sexual orientation, disability, whatever. So in diversity, the word is diversity. People have diverse situations somewhere, and then you need to accept them. That's the meaning of diversity. Whilst equality is treating people fairly, diversity is accepting people for who they are. Okay?
Okay.
Now, let's look at the underpinning principles of care. To protect valuable service users from mistreatment and improve quality of life, caregivers must follow the principles of care Act 2014. The principles aim to emphasize that everyone in care is a human being with wants and needs. They define how important it is to involve a service user in the process of assessing their safeguarding needs. The Care Act 2014 encourages caregivers to take a person-centered approach when safeguarding vulnerable adults. When you follow the principles, you too place the vulnerable person's well-being and needs at the forefront of safeguarding processes. They help you directly involve the vulnerable person, and any nominated people can help reach decisions in the vulnerable adult's best interest when managing safeguarding concerns and care plans. Okay. Now, the 6 principles of Care Act are 1, empowerment, protection, prevention, proportionality, partnership, and accountability. Okay. These are the 3 principles of Care Act. Let's look at empowerment. Where empowerment is the principle that encourages to support vulnerable adults so they can confidentially make their own decision, what we call independence. Okay. In care, we call this independence, so they can make independent choices and decisions. Protection, your duty is to provide service users with clear, simple information about how to recognize the signs of abuse and when to come to you for help. Very, very important. And prevention is to follow the prevention principle. You must be proactive to stop safeguarding concerns from developing in the first place. Proportionality, to make your safeguarding processes proportionate, involve the vulnerable adults when making decisions. They can give you input on what actions in their mind and have the least impact on their quality of life and dignity. Partnership. You should partner with local services and opportunities to help prevent, detect, and report suspected cases of neglect and abuse. When multiple authorities recognize a safeguarding issue and submit a report, the authorities can react quickly and commit. I think we spoke about this the last time, that when somebody when there's a safeguarding concern in a care home or whatever, they will need to report to local authorities of the safeguarding team, or sometimes the CQC. We spoke about that. Okay. So this is what we call partnership. They are partnership with local services, safeguarding team, the police. They are all partners that work with care homes or healthcare providers against abuse and other related activities. Accountability. Be wholly transparent about and take responsibility for all the safeguarding practices that you use to support vulnerable. You should be accountable. That's why you have been trained. Okay. Let's look at dignity agenda. Dignity in care policy. The aim of the policy is to achieve high standard of patient dignity and to place the patient experience high on everyone's agenda. The policy provides a framework and standard for improving the experience of patients in all areas of trust. Duty of care. You not only have a duty of care to individuals who you are caring for and supporting, but also to other workers. For example, if you were working in a hospital, you would have a duty of care as to doctors, nurses, healthcare support workers, caterers, cleaners, maintenance workers. Caterers, when you say caterers, do you understand? Caterers. Cleaners, maintenance workers.
Yes.
Okay. So the duty of care does not relate to only carers, but also goes beyond carers to even cleaners. They also have a duty of care. Maintenance workers also have a duty of care. Safeguarding. Safeguarding means protecting a citizen's health, well-being, and human rights, enabling them to live from harm, abuse, and neglect. It is an integral part of providing high-quality health care. Safeguarding children, young people, and adults is a collective responsibility. Ethics. Healthcare ethics refer to a set of moral values and principles to be used for decision-making in the field of medicine. Example is confidentiality, code of conduct, and others. Those are very key things when it comes to ethics, okay? The ethics is that you have a set of moral values and principles to be used for decision-making in the field of medicine. Very, very important. Very, very important. Then we have to look at what are those impacts do these principles have on the provision of care? The impact of empowerment, protection, prevention, proportionate, and accountability. What impact do they have? For example, one of those impacts is that on quality and safety of care, you ensure that the right services are offered and that they are of a good quality whilst considering the paramount safety of service user. Very, very important, okay? Very, very, very important in the provision of care. Then let's look at the support for rights and individuals. Having the right and support given by most appropriate services. Refer to the most appropriate services if required. Mental health, bereavement, specialized treatment. Very, very important. Consistency and coordination of care. That there is a consistency of care. Service users having access to the same set of care to ensure consistency and that care is coordinated. Just we spoke about this last week, didn't we?
Yeah.
Good. Suleiman, you understand, do you? Suleiman, do you understand? Lukman.
Yes, please, I understand.
Okay, let's proceed. There's also an impact on the failure to comply the provision of care. It can lead to, if you don't provide those, it can lead to poor quality care, infringement of rights, safeguarding issues, striking off by professional body. Striking off, we spoke about that, that those who work in organization that is regulated, example, MSC, GMC, ACPC, isn't it? Jesse, we spoke about that, didn't we?
Yes, we spoke about it last lesson.
Good. So if you don't comply with that, you can be strike off your qualification. And we said that when it comes to health carers, you don't belong to any of them, but then the DBS have the right to bar you, isn't it?
Yes.
Yeah.
Okay. Good. Now, so let's look at some of the initiatives. There are many initiatives within UK that promote and promote the fundamental principle of care within health and social care. One of those is UK Dignity Agenda, promotion of rights, person-centered care, which we know about, considering the patient first, and then the 6 C's. Okay. The UK Dignity Agenda, in recent years, the importance of the dignity in care agenda has rightly increased within health and social care context. For example, United Lincolnshire Hospital NHS Trust is committed to ensuring that all patients and their families carers are treated with dignity and respect throughout their care journey. Dignity in care is everyone's business. Whether engaged in direct patient care or working in one of the many support roles within the organization, each employee must understand the impact of their words and the actions upon the qualitative patient experience. Dignity in care policy. The aim of the policy is to achieve high standard of patient dignity and to place the patient experience high on everyone's agenda. The policy provides a framework and standard for improving the experiences of patients in all areas of the trust. Very, very, very important. Okay. Then we have the policy articulates clearly that every employee would uphold values and behaviors to the highest standard in relation to dignity in care. This includes to put the patient and public at the center of our work. We will treat patients, colleagues, visitors with respect, dignity, and empathy. Very important. The difference between sympathy and empathy. Okay. The policy also has sections relating to service provision and building design, education and training, same gender accommodation, that you can say diversity, care provision, advocacy, and advice. That's what the 6C62 advice. Okay. Where provision of rights, you can look at that NHS follows the Human Rights Act and it promotes each individual's act. We have the Article 6 UN United Nations Convention, which talks about the human rights, and Article 8, right to live and the right to human rights. Everybody in the UK has a right to human rights. Okay, the UK Human Rights Act contains 15 basic rights: the right to life, the right to be touched, not to be tortured or treated inhuman, the right to be free from slavery and forced labor, the right to liberty and security, the right to a fair trial, the right to with no punishment without law, the right to respect for private life and family. Okay, that's the most popular one, right to private life and family. That's Article 8 of the United Nations Convention. Right to freedom of thought, right to freedom of expression, right to freedom of assembly, right for peaceful enjoyment, right to education, and right to free elections. Okay, and so you realize that when we say live to remain, that's what you mean. Right to live, that's what you mean. Person-centered care, we've spoken about it, so I wouldn't want to go much about it. Okay, it's all about patient's priority. The 6 C's of person-centered care is care, compassion, competence, communication, courage, and commitment. Okay, how do you think that these principles support basic human rights? Okay, can I ask a question? The 6 C's: care, compassion, competence, communication, courage, and commitment. How do you think, Jesse Solomon Olushola, that these 6 C's, how do they impact on human rights? How does this principle support basic human rights? Guys, are you there?
Yeah, I'm with you.
They make sure that they're treated with high quality care by the NHS or social workers.
Yeah, to me, I'll say it give the level of proper care to the service user, and with the with the help of those principles, it give good quality to the service user for in order to support them at in the best level. To me,
That's good. Guys have that. That's good. That's good. Then let's look into some of the principles of basic human rights. Principles that are used in healthcare provide a sort of clear ideologies for setting and evaluating health policy and service delivery, targeting discriminatory practices and unjust power relations that are the heart of inequitable health outcomes. Very, very important. These basic human rights should support respect, dignity, inclusion, diversity, and inclusion. We spoke about that. Impartiality, confidentiality, individual rights, and responsibilities. What is your understanding on confidentiality, please? Yes.
Confidentiality means that the carers have a duty to keep patients' information undisclosed unless the law says they have to, or there's an overriding common interest from the public.
Good.
As I say, right to the service user privacy, it shouldn't be leaked out to any third party, or any you as the staff, you don't have right to give out any personal information about the service user to any third party without genuine reason for doing that, because there are some situations whereby there might be a genuine reason for doing that, maybe to help the service user, but you don't have right to give out information, private information about the third party to any, about the service user to any third party to me.
Good. So, I'll therefore say at what point can we break confidentiality then?
You can break it if there's a safeguarding issue.
Also,
Yeah. So if we can break confidentiality if it's become a risk to the service user.
awesome. Awesome. Let's crack on. Wonderful students. Okay. Now, how do we assess the underlying principles to support basic human rights? Empowerment, protection, prevention, partiality, and we spoke about safeguarding, equal access to care, overall underpinning principles and values ensure quality, access, and coordination for all service users. Also, the implications of failure to adhere to fundamental principles of care. It is important to know that recognize that even though many of the principles and values may not be mandatory within healthcare, there are implications from not following them. This may include lack of equality, wage of rights, accessibility issues, serious injuries. Ill health for health service users, ill health is not the best. Inadequate services, miscoordination, misappointments resulting to lack of care for service users. Negligence, very, very important. Negligence. Clinicians and carers may fail to conduct themselves in an appropriate manner, leading to failure to take proper care of their service users. Service users is not barbed. The worker since morning is dirty, his weed is pulled, he's not being chained and all that. That's neglect. That's neglect. Okay, gross misconduct. When someone accuses a harm through serious negligence, is unable to perform at work due to alcohol, illegal drug, these are all things not accepted, and this can lead to you being struck off by the DBS. So we have ended. Today's lectures, we discuss underpinning principles of health and social care, outlining how these principles impact on the provision of care, explaining the initiative to promote the fundamental principles among those working in health and social care, assessing how underlying principles support basic human rights, assessing the implications of failing to adhere to those fundamental principles of care. Do we have any questions at all?
No, thank you.
Solomon, do you have any questions at all?
Yeah, well, I'll say for now, no for now.
Okay, so on the references list, you have it on your model. These are Principles of Care Act 2014, safeguarding information you can get for care.
So I'm sorry, so I have a question. If I want to get this lecture notes, how do I go about it, please?
To be on the YouTube or your model. After every lecture, they capture it there.
I mean the soft copy.
The recordings, you only get the recordings.
Oh, we don't get the soft copy.
The soft copy is on your
The
model.
soft copy is on the
student
module.
Okay. I'm sorry.
This what I'm teaching. You have everything on your student
On your
model.
model. All right. Thank
But
you.
the recording, after I think Monday or Tuesday, they'll put it out there, the recording as well.
Okay. All right. No
I can
worries.
also share the recording on the group when I have time. Okay.
All right.
I think that would be quite better then, because the previous one I have to be chasing them. I'm sorry, I had
I
to
did not
be.
send them to you.
Only one was sent to me. The one on Saturday was sent to me, and then I've listened to that. About the one on Sunday has not yet been sent to me.
Why?
Lukman,
I'm probably check YouTube. Yeah.
you need to go on your student module. Everything is on the student module.
Okay.
Yes.
Do you have your login details, Lukman?
Yeah, I have my login details.
Then login, you have all the information there.
Once you log in, you go to the course. Under the course, you will see LO1, LO2, LO3.
Okay.
Yes,
Okay.
you will see the soft copy and you also see the recorded version.
All right. I'll do that. Thank you very much. Really appreciate it.
Okay, so Lukman, Olushola Jesse, on the references, take note. These are references that you can read more about it to help you in working on your assignments. Okay.
All right.
Now we have one more. Are we done? Do we have LO4?
No, we have assignment discussion.
That'll be when is that? Is it next week?
Tomorrow, 5 o'clock.
Tomorrow, so 5 o'clock, isn't it?
No,
Okay.
5 o'clock in the evening.
3 o'clock.
3 o'clock.
So tomorrow is our last lecture on assignment discussion. Okay.
Yes.
That's when we have time to go through, and then we can have a bit of discussion on assignments. Okay.
Yes.
I expect that by now, Jesse and Olushola, you started on the assignments by now.
Yeah, I've started.
Yes, you should have started by now. Okay, we've done 2 lectures. This is the last one. You should have started on 1 and 2 by now. And if you have any questions tomorrow when you meet, we can discuss. Okay. For Lukman, quickly go back to your model, access them, and start tackling the questions. Okay.
Okay. I will.
Make sure you join the class tomorrow. Make sure you join the class tomorrow.
I will.
If you have any questions, you have my private number there on the group. You can message me. Okay.
All right. I'll do that.
Guys, I wish you all the best. Okay.
All right. Bye.
Thank you.
And thanks so much for your patience. All right. Thanks
No
for your
problem.
patience. All right. Take care.